Running left kidneys do all sorts of cool things you'll see. Please pay close attention, this lesson is free.
Good afternoon and welcome to our lab. I am student nurse Lacian Lamont, and today we will be conducting a series of urinalysis tests. Urinalysis tests are done to detect and manage a wide range of disorders such as urinary tract infection, diabetes, liver, and kidney disorders. It involves checking the appearance, concentration, and the content of urine. Please follow me while I introduce you guys to my colleagues.
Hi, I'm student nurse Clark, and I will be doing the sugar in urine test along with my colleague Danielle.
Hello, I'm Sawachi Mokacha. I'll be doing protein in urine with Peter Gay.
Hi, I'm student nurse Ibert, and nurse Lamont and myself will be conducting the presence of ketone in urine test.
Hi, I'm student nurse Brown.
And I am student nurse Green.
And together we'll be conducting the 24-hour
Hi, my name is student nurse Anika Francis, and this is student nurse Deans. We'll be conducting the specific gravity test.
Urine test, the patient should ensure that they're well hydrated, as this makes collecting the urine sample easier. The nurse or the medical practitioner should also note any medication that the patient is on, and also if they have done strenuous activities, as this will impact the results of the urine test. Foods to be avoided are beets, blackberries, and coffee, as this will change the color of the urine. Handling of the sample. Sample should be collected in a sterile container and labeled with patient name and other important information on the bottle and not on the lid. A sterile syringe should be used to remove some of the urine from the container and place it onto the dipstick. This ensures that the specimen will remain untouched, so it can be sent to the lab if further tests are needed.
Urine screening tests using a dipstick. Get a sample of your urine in a clean container. Remove a strip pad from the strip bottle. Place the strip pad in the urine and gently shake excess urine off the strip. Set your timer and wait for the strip pad to change color. You can do this for about a minute. Then you compare the strip pad to the color chart.
A 24-hour urine collection is a simple lab test that is done to measure what's in your urine. A 24-hour urine collection is also done to diagnose kidney diseases. It also measures how much creatinine is cleared in the kidney. It also measures hormones, minerals, and other chemical compounds found in the urine.
collection test. A nurse usually asks the patient if he or she is on any over-the-counter medication. If so, the patient has to stop taking these during the 24-hour period. The patient is usually advised not to change their diet and continue their daily food intake. Okay, so the patient is given a specimen bottle to which he or she would void his or her urine in. Now for the men, they can void their urine directly into the bottle. However, for the female, she can urinate inside a cup and pour it into a specimen bottle. Now the first urine is not collected, reason being it is usually highly concentrated. Now we usually collect it, so it's flushed. Now we usually collect the urine after that, and each urine that is poured into the specimen bottle, it is recorded. Now at the end of the 24-hour period, I need to mention very important fact that the urine has to be refrigerated, because if left open, it allows for the growth of microorganisms. Now, after the 24-hour period, the specimen is bottled and ice pack is placed inside the box that is going to be sent to the lab because, as I said before, the urine has to be refrigerated and the specimen bottle is placed on top of it and it is closed and it is sent to the lab to be tested.
Protein in urine test helps us to measure the amount of protein in our urine. We have more than 200 proteins in our urine, and the most common of it is albumin. When there is loss of protein in our urine, there is tend to be because we have dehydration, fever, exposure to cold temperature, and strenuous exercises. When the dipstick shows a green color, that's to show there is protein in the urine.
The kidney filter waste product from the blood, including protein. However, some diseases and conditions allow protein to pass through the filter of the kidney. Therefore, protein will be seen in your urine. The darker the green color, the higher the concentration of protein. Healthy adults secrete less than 150 milligrams of protein over a 24-hour period. The healthcare provider may order regular urine protein testing to screen for kidney problems if you have one or more of the following risk factors, such as urinary tract infection, family history of kidney disease, being overweight, or having chronic conditions such as diabetes, or just being old.
Each day we go to the bathroom and we see our urine discolored, as in being a brighter shade of yellow or a lighter. So, today we'll be speaking about sugars in urine. According to the World Health Organization, normally when blood is filtered in the kidneys, some sugar remains in the fluid that will later become urine. If the level of blood sugar is low, as is normally the case, the body can reabsorb sugar from the fluid before it leaves the kidney to be excreted as urine. When the blood sugar is high, there is too much sugar in the fluid, leaving the kidneys to be reabsorbed, so the excess sugar passes into the urine.
Testing for sugar in urine relies on the interaction between sugar with glucose oxidase on the dipstick to form hydrogen peroxide, which results in color change. Glucosuria is 0 to 0.8 millimoles per liter. The urine dipstick uses pluses to indicate the level of sugar in the urine at the time of the sample.
A color change of light green indicates that there is a trace of glucose in the urine. The value of this is 5.55 millimoles per liter.
Indicates 1 plus glucose in the urine, which is 11.1 millimoles per liter. This indicates 250 milligrams per deciliter of glucose is being lost via urine.
Brown color change indicates that there is a 2 plus level of glucose in the urine. This value is 27.75 millimoles per liter, which indicates 500 milligrams per deciliter is being lost via urine.
A light brown color change indicates 3 plus glucose urine levels, which is 55.5 millimoles per liter. This is indicative of more than 1000 milligrams per deciliter of sugar being lost through urine.
A brown color change indicates that there is a 4 plus level of sugar in the urine.
Conditions in which levels in the urine are above 100 milligrams per deciliter and detectable include diabetes mellitus or DM, impaired tubular reabsorption due to advanced kidney disease, pregnancy,
pancreatic disease, disturbances and metabolism such as burns, infections, and fractures.
Specific gravity measures the concentration of solutes in the urine and gives info on the ability of the kidneys to concentrate the urine. The test demonstrates the potential of the renal tubules to remove water from the urine and return it to the blood. Basically, the test compares the density of urine against the density of water, which has a specific gravity of 1.00, which can determine how effective the kidneys are in monitoring the body's overall balance of fluids. The specific gravity test can be conducted in 3 ways using the dipstick, the refractometer, or the urinometer.
As she mentioned before, the other methods used to determine the specific gravity of a urine sample is refractometer and uranometer. Important to note, the uranometer is the most effective.
No, it's the least effective method of the 3.
And the refractometer would be the most effective of the 3.
Right.
It's important to note that a normal reading for a specific gravity should be between 1.005 to 1.030. And for children less than 2 years, this should be 1.001 to 1.018.
These values of specific gravity can be of clinical importance in indicating whether or not a patient has diabetes or hypertension. Diabetes can be indicated when the specific gravity of urine is at its highest or is high, which is normally above 1.03, and hypertension is indicated when the specific gravity is at its lowest.
To note is that early chronic renal disease can also be indicated with a high specific gravity reading.
Ketones are produced in the body when fats rather than glucose are used to produce energy. When there is a buildup of ketone in the body, it is a sign that the body blood sugar level is high. It may mean that you have diabetic ketoacidosis, which is a potentially life-threatening condition.
The color change is as a result of acetoacetic acid reacting with nitroprusside. In the concentration of ketone in urine, less than 0.6 millimoles per liter is normal. 0.6 millimoles to 1.5 millimoles per liter is moderate. 1.6 millimoles to 3.0 millimoles per liter is high, and greater than 3.0 millimoles is very high. Small or trace amounts of ketones may mean that ketone buildup is starting. Great amounts of ketones are a danger sign. They upset the chemical balance of your blood and can poison the body.
Also, diabetic ketones in the urine are a sure sign that your diabetes is out of control. Ketones can also make your blood acidic. This can lead to DKA. The most serious effects of DKA include swelling of the brain, loss of consciousness, diabetic coma, and in severe cases, death.
Come.
This is the end of our urine analysis series. So keep watching Crash Course.
This is the end of our urine analysis test.
Keep watching Crash Course.
Adios, mi amor. If you walk out through